Good afternoon, everyone. My name is Moises Agosto Rosario. I'm the Director of Treatment for IMMAC, formerly known as the National Minority AIDS Council. And today in our webinar, we have a topic that has been of a lot of interest for a lot of members of our community in our HIV 50 program, as well as on other organizations programs related to aging and HIV. And the issue is around isolation. We've been lucky enough to be approached by the ACL and HHS to talk to us about a program that they have in place about isolation and things that programmatically can be done and networks that could be built to address this awful issue that is affecting our communities. As I don't know if you recently saw how the WHO said that isolation and loneliness was a very critical health issue. So it's very relevant and very important that we're talking about it now. So I'm going to pass it to Katie Clark, and she's going to introduce herself. She's with ACL, and we go from there. So go ahead, Katie.
Thank you so much, and thank you all for joining us today. I feel so grateful to have this opportunity to speak with you all. My name is Katie Clark, and I lead social connection programs at the Administration for Community Living, or ACL. And ACL's mission is to maximize independence, well-being, and the health of older adults and people living with disabilities. And social connection is so central to that mission. I will also note that I've been a primary caregiver for my mother and my grandfather, so this work is just so close to my heart, and I think that is true for all Americans and all peoples living in the US. So really appreciate you giving me the opportunity to share more about this topic today. Today, I will briefly share how older adults, and especially specifically older adults living with HIV, may be at higher risk for loneliness and social isolation. I will then explain how loneliness and social isolation do affect our health. And finally, I want to highlight just 2 opportunities to further engage in this topic and grow in your capacity to promote social connections. So we can go ahead to go to the next slide. So I wanted to first start with just definitions. I think we all are very familiar with the words and the terms social isolation, social connection, and loneliness, but they are very related but distinctly different. So it's always good to kind of start with those definitions. So as you can see here, loneliness is subjective. Really, it is a feeling that you feel. It is like tied to your emotions, whereas being socially isolated is objective. It has to do with factors that are measurable, and it is like a state of being. So again, they're closely related, but distinctly different. You can be living in New York City, surrounded by people in the streets, in your community, and maybe you might still feel lonely. You can also you can feel connected and socially engaged and not lonely, but may live in a very socially isolated place, such as a rural community where you are limited with your social groups, your social interaction. So just keep in mind that they are distinctly different terms, and to be mindful of what words we use when we talk about this topic. I also want to note very quickly that social isolation is not a personal choice or an individual problem. Really, this is one that is rooted in community design and social norms, and also systemic injustices. And I know there's a lot of shame sometimes in feeling lonely and being socially isolated, but we can all feel loneliness. We can all be socially isolated. And aging in place, living with a chronic illness, living with HIV comes with many risk factors tied to social isolation. And we can go ahead to the next slide. So I just listed a few of these risk factors, and these are all true for social isolation and loneliness generally, but I'm sure you can take a look at this list and see some items that you might know to be true with the people living with HIV in that specific population. So especially want to focus on experiences that older adults often have that could put them at greater risk for being socially isolated. This could be experiencing a major loss or life change. Maybe you have friends that are passing away or moving. Maybe your partner has passed away. You may have a loss of mobility, or your access to transportation is changing. Maybe you cannot drive anymore. You're limited with how you can drive, maybe not in the dark. You have worsening vision or hearing. Sometimes it's separation from family and friends. Maybe it's financial challenges, living alone, but also just forms of discrimination. So, this is just a few of those risk factors, but again, let's all remember that this is really not a problem that an individual should be carrying on their shoulders, but one that is influenced by these greater factors. So you can go ahead and go to the next slide. So I just wanted to highlight, especially for this audience, that folks are really beginning to talk about people living with HIV and their unique experience with social connection and social isolation and loneliness. I read this really good report. It was the Health HIV State of Aging and HIV National Survey. And it noted that this community, this population group, has a very strong need for social groups, for social activities and social support. This is a top priority. And although we have around 66% who are participating in community groups, I'd love to see that be 100%. We still see, 32% don't have anyone to take care of them when they're sick or they're injured. And even more heartbreaking, 7% say they have no one to call in case of an emergency. So, this is something that I think we are beginning to pay attention to, and maybe you all know very close to your hearts, and I hope we can continue to focus on this population group. Go ahead and go to the next slide. So very, very briefly, I just want to highlight this data right here. So in the US, this was a study done. We can see that 40% of people who are living with a debilitating disability or a chronic disease experience loneliness and social isolation. And that is like the lighter blue bar. The darker blue bar is for people living with serious mental health conditions at 47%. And that is just truly breaks my heart. These are real people in our community. These are our loved ones. That is almost half of individuals who are living with chronic disease really struggling here. Go ahead and go to the next slide. So this is just specific to people who are aging in the US, the general population. This was a study that, a national poll that took a national sample of US adults ages 50 to 80, so a pretty wide age group for older and aging adults. And you can see here that before COVID in 2018, a large proportion of adults were socially isolated, 27%. This is a big number in and of itself. And then we know during COVID-19, it got a lot worse. So we have in June 2020, 2021, that number increasing to 56% at the most. Again, that is, I try and think in real people here, that's a little bit more than half of older and aging adults from this national sample. And as of January 2023, it's gone down a little bit. It is around 34%, but still not back to that pre-pandemic number. And again, 34% still way too high. That is around 1 in 3 older adults experiencing social isolation. We'll go to the next slide. So this chart is the same data, the same sample as the last one, but a little bit more in detail. It compares the results by physical and mental health status. So again, these numbers are from a national sample of US adults aged 50 to 80. And we can see here that social isolation and loneliness is more common for those who have poor mental or physical health. So about more than half, at 55%, of older adults with fair or poor physical health experience social isolation. And that's inclusive of just fair health as well. And then you can see here, and this is really troubling, that more than 3/4 of older adults with fair or poor mental health are socially isolated at 77%. And this is just so alarming to me. It's really hard to see. And you can see that the trend is quite similar for feeling a lack of companionship. So that's that loneliness, that feeling. We see that 55% of older adults with fair or poor physical health felt that lack of companionship. And then similar to the physical health and social isolation, 73% of older adults with fair or poor mental health lacked that companionship. So before I continue, I want us to just pause and reflect and sit with our loved ones, our family members, our community members that are 50 to 80 years old. This data is a national sample. It is reflective of the national population in the US. And so when I say 73% of older adults with fair or poor mental health lack companionship, I'm talking about, those are people in our own communities. That is, 3/4 of older adults. That's really, really troubling. So we can go ahead and go to the next slide. So very quickly, what is the link between social isolation and health? Why is there a relationship between the two? So social connection can influence many biological processes. So this includes your stress, your hormone regulation, how well your immune system is functioning against illness, and also your gene expression. And research also tells us that social connection influences your psychological processes as well. So this includes your perception of stress, your sense of purpose and meaning, how safe you feel, how resilient you are, and also how hopeful you are. And finally, social connection also influences our behaviors. When we are socially connected, we are more likely to be physically active. We're more likely to have better nutrition habits and sleep habits. We also smoke cigarettes less, we drink less alcohol, and we also take our medication as prescribed. So all of these processes have very real direct health benefits or impacts. And the research is really there. We have that evidence to tell us that. Go ahead to the next slide. So social connection is really as essential to survival as water and food and even shelter. And when we lack social connection, there are very serious health consequences. And this is just like a very quick overview on the research. We know that we have an increased risk for heart disease, for stroke, for diabetes, for depression and anxiety, and other forms of chronic disease. And also, I just want to note, social isolation really increases the death and risk of death from all causes, and really rivals the risk of smoking, obesity, and the lack of physical activity. This is a really startling statistic, but one that has made a lot of headlines in recent years. Research shows that long-term loneliness is just as damaging to your health as smoking 15 cigarettes a day. 15 cigarettes a day. In addition to higher rates of mental health conditions, loneliness may also lead to a quicker functional decline. And I know I've seen that with my own loved ones. You know, when they're isolated, when they're lonely, they become more frail much more quickly, which is really hard to see. Next slide. So again, very quickly, yeah, we focused on the health outcomes here, but I want to note that there are important and valuable non-health outcomes when you are socially connected. So we know that children and adolescents and young adults who enjoy positive relationships with their peers, their parents, their teachers, they do better in school. They have better attendance, they have better grades, they do well on test scores, they're more involved, they participate. Social connection is also really valuable in the workplace and is associated with higher satisfaction. We are more creative, we have a higher level of competence, and we perform better in our jobs. And finally, just people who live in socially connected communities are more likely to thrive. We feel safer, we feel welcome, and we're able to trust each other in our own communities. And I really, really believe that. Next slide. So very briefly, I just wanted to talk about some opportunities for you all to be engaged in this work and to connect with others that are very interested in promoting social connection, addressing social isolation and loneliness. Again, I work for ACL, which is a part of Health and Human Services in the federal government. And one of the things that we have invested in is what we like to call the nationwide network of champions. And so this is an online, completely free community platform that allows you to network, post resources, engage in discussion, and collaborate and learn about what's going on across the country as it relates to just social connection and social isolation and loneliness. So go ahead to the next slide. So this is what you would see. I think the link was in the last slide and I can share it in the chat afterwards. But the first time that you sign in, we'll ask that you just create an account. And this is probably what the website will look like for you. Go ahead to the next slide. And it will just be a very simple kind of online form. We'll review it, and usually within like 1 to 3 business days, we accept you and allow you access. Really, we only do this because unfortunately there are some like online bots, and we just want to make sure it's a space where people are talking to other real humans who are engaged in this space, and it's not those kind of online robots. So you'll put in an application, again, completely free. We accept everyone, and we really it's a space for people that are interested in learning more and connecting with other people on this topic. So you can go to the next slide. So this is the homepage. This is what you would see when you log in. And as you can see, we have discussion boards, resources, events, a directory, and a community board as well. So a lot of ways to kind of get plugged in to work that's going on across the country on social isolation and loneliness. Go ahead to the next slide. So this is just a screenshot really from earlier today of the kinds of discussion boards that the discussions that are ongoing right now with other people who are members in this platform. So it's a lot of, the way that I like to frame this discussion board, it feels very similar to when you're in your office and you just have a really quick question and you kind of look around and you're able to go to the cubicle next to you and ask the question. This is a very informal space. It's a way to access other professionals, other volunteers, other leaders in communities and just ask them, hey, how do you get more people to show up to your events? You know, did you see this recent report? Did it surprise you? I just heard about this opportunity to receive funding from Veterans Affairs on innovation. As you can see, that's one of the more recent posts. So it's a lot of really good dialogue. It always also kind of reminds me of the chat that is ongoing in like webinars like this, where people are just very, it's very grassroots, very organic, and can be a great resource. Go ahead to the next slide. So you can see here we have representation from almost all of the states, not quite all of them yet, but very close, just over 400 members. And you're able to view the directory and access members from your state or from similar states as you. Again, to just partner and network and see kind of what the work is like in these areas across the country. Perhaps you want to know what exists for people who are socially isolated and lonely in your state. You can find those people that are connected to this network. Go ahead to the next slide. Okay, so this is our second item that I just wanted to highlight for you. I think it's a very helpful place to get started if you haven't done anything related to social isolation as like the primary focus or primary outcome of a program. This is our Innovations Hub. So it's an online inventory of best practices, programs, services, and just ideas. So you can kind of get a sense of what is ongoing across the U.S. So we go to the next slide. So this is a screenshot of the hub, and you can see here that there are different filters. So you can search and filter by population group, or maybe the partners involved, the funding source, an intervention type. And for every single item in this inventory, you can click on it and it will have information about a description of the project. You can see the outcomes related to the project, the materials needed, if it was like a free opportunity or if it had a high cost. And we always have contact information as well. So if you're looking to just get started and find out what already exists so that you can replicate a program that we know kind of works, this is a really, really good space for that. Okay. And I think that is all I have for you today. And I think we have some time for questions, but really, again, appreciate you all welcoming me here, and just really look forward to answering some questions and learning more about you all.
Okay, so one of the questions that came up in the chat was somebody asked what comes first, poor health because of isolation, or is the isolation because of the poor health?
I think it's both. As we saw before in one of the slides, when you are socially isolated, you like your health outcomes can become worse. You're maybe not taking your medication. You are experiencing higher levels of stress, maybe lifestyle changes that are affecting your health. But people that are living with certain diseases or health challenges, they because the world is not easy for those people. The environment, it can be challenging. Yeah, I would say it really is both, because I think it's always important to think about this from a structural perspective, that the discrimination, the social injustices, and the transportation challenges, the financial challenges, like all of those things can really further isolate folks, in addition to just those very real like health outcomes that are related to being socially isolated.
Thank you. And there are still questions coming in, so everybody keep asking your questions in the chat. I'm going to turn it back over to Moises while people are typing.
Just had a question about like demographics. I mean, do you have any numbers in terms of a specific, I mean, when we talk in the context of health disparities, you know, how marked are they in the specific groups, African Americans or Latinx, or, do we see this same kind of tendency of disparities when we talk about social isolation and loneliness?
I think we do, but there are also like unique opportunities for certain communities of different racial and ethnic backgrounds to have stronger support systems. So we know that when you are experiencing discrimination, when you don't have great access to healthcare, maybe you are living in an area where there's less access to recreation and public parks, all of those things that can come from systematic racism or injustice, that those have real consequences on your health and your social connection. But I would also note that there are some really strong communities and really strong social support systems and networks that exist in communities of color that can be a huge benefit. So I think it can be both. When we think about this topic, we always need to make sure that our services, our programs, and our outreach are culturally relevant, because it's a tough topic, and we don't want to further isolate people by trying to talk to them about isolation. And we know that stigma can look different in such different communities around being isolated. So, I encourage everyone to really think about this from a culturally relevant way, to always partner with local organizations or people with lived experiences to understand their values and the strengths that exist in their community, because it really is just going to look different, even between rural and urban communities. We know rural communities have very real challenges. They have less transportation, maybe their broadband or Wi-Fi is not as strong, but there's also a lot of really strong support systems that can exist in rural communities where they really are able to rely on each other for a lot of things. But it's really important to think about that and carry that perspective with us when we think about this topic.
Great. And it just made me think about also how important would be to bring this conversation to service providers.
Yeah.
Like I'm thinking when we started the aging and HIV program, one of the main concerns we started with isolation, but one also main concern is that you are talking about a population that have layers of identities.
Right.
They are racial, a racial group. They are a sexual orientation group. They are, a gender group. They are SES, socioeconomic status group, and all these things build. And I cannot avoid thinking that there must be a difference in the way that you experience one identity discrimination between that and the layers of different identities that the discrimination play out differently.
Yeah.
And we tend to provide one, like I think you mentioned that, like one LGBT service, one African American service, and we still haven't been able to figure
Yeah.
out to deal with all
Yeah.
of them at once.
Yeah. I agree with you. I think we need to be thinking about how all of our identities are intersecting and overlapping. And I think it's also really important to think about our communities and places where people already feel really connected, and to work with those community partners where maybe they already like have that strong support system and they're kind of falling off, or just no matter what, I think community partnership is a huge first step. And the healthcare industry can do a lot in that, and just understanding people's needs. People are going to have different wants. What makes me lonely might not be the same as what makes you lonely. And maybe I just want a bus ride to go grocery shopping so I can make cookies on a Friday night, and that's kind of what I need to feel connected. Someone else might want a phone call every day. Everyone's going to be different and have a different appetite for their needs. So it's it's tough. We have to really look at the person in a holistic way and understand their limitations, where they're already connected, and then work with those community groups as well that already have the strong networks and understand those intersecting identities.
Absolutely. Taylor, do we have more questions?
We sure do, and some comments. So one comment that came in that they wanted to share with you is that social connection is good and meaningful social connection is ideal.
Mm-hmm.
Another comment that came in, there's a lot of people asking for your slides and the link to the network, by the way. Do you mind, will you probably just follow up with us after so we can get that information out to everybody, Katie?
Yeah, absolutely. And more than happy to share my slides with you all. And I'll also make a note, I can pass on my contact information. I just love partnering with people and understanding the work that you all are doing. It only makes us all stronger when we can work together. And I have those relationships with people that are a little bit closer to the work. So I'm here. I'm always happy to do presentations or share resources and learn more about your experience from your perspective too. It's all helpful, I think, for everyone.
If I am able to, on my end, I will get that information out to all the attendees. But to attendees, if I am not able to do that from my end through the webinar platform, please do contact NMAC at communications@nmac.org. That's communications@nmac.org, and I will get that information to you right away. Another question that came in is from Alejandra Aguilera in Minnesota. And Alejandro asks, can any organizations post their resources to the network, or does the organization need to be specifically an HIV organization?
Anyone can share anything they see relevant. It's a very, very informal grassroots space. There's no the only vetting we do is in the beginning just to make sure folks are who they say they are. And really that's it. So, if you have flyers, people will share flyers, events. Maybe they put together a toolkit or a brochure and they're willing to share that with other people because they can replicate it. We have all of that posted, and please feel free to engage. I think it would be really great to see that.
We had another comment that came in. We recommend, this is from Jules Levin. It says, we recommend to all people with HIV who are aging to develop social engagement with people, exercise and practice, and good health and healthy lifestyles. With aging and frailty, one tends to stay home.
Mm-hmm. Yeah, that definitely is true. And like I said, as we age, we maybe become more frail, but the more isolated we are, it happens at a quicker rate. So I appreciate you doing that.
We had another comment coming from Bill Hall that says, an area that I think is overlooked is AIDS fatigue, having to do everything people living with AIDS has to do month after month becomes tiresome, and it's also reaching a stage in our age where health problems become more prevalent.
Yeah, absolutely. Absolutely. I think I completely agree with you. It's another big risk factor, I think, for older adults.
And our last comment is, this is from Lynette Moore with World in Oakland, California. She says, it would be awesome to have you do a Zoom meeting with us.
I would love that. I hope we can connect.
Awesome. Moises, I think that's it for questions for right now.
Great. Well, thank you, Kathy. This has been amazing, and I'm sure people have appreciate the talk, and they're going to be reaching out to you. I was going to say, make sure that you know what you're asking for. It's gonna, it's gonna have a tsunami of like events,
It's a
which is
good problem to have. Yeah, it's a good problem to have. And I take that as passion around this issue and you all being close to it. I think every time I give a conversation about this, like a talk in a meeting or a webinar, I always like pause because we can look at the numbers, but we all have lived this. We all have people in our life that we love, or maybe ourselves, who have really struggled with loneliness or isolation, and we've seen what that's done to their health and their well-being. So I'll take the many emails as passion behind that and fixing that, and I welcome it. So again, really appreciate you all allowing me to share today.
I love that you have that passion. I think it's great. Okay, so this we hope is not the only time we do this. Maybe we can bring you again and do another round of presentation about the program. I think this is something that people will find very useful, and for some could be life-saving. So thank you again, and thank you everybody that participated, that provided questions and comments. We do appreciate you, and we do appreciate your wisdom. And with that, we say until the next one, and happy holidays to everybody.